responses all over the body, which can ease joint pain and promote a good night's sleep, which is why so many people like to drink it at night. Number 4 is green tea. Now, believe it or not, green tea is actually made from the exact same plant, Camellia sinensis, as a bunch of other teas you've probably heard of. Black tea, white tea, yellow tea, and oolong tea are all made from the same plant. Green tea is only different in terms of the way that it's processed. But green tea is the healthiest of them all by far. It's loaded with antioxidants, especially one called epigallocatechin gallate, EGCG, which has been shown to inhibit inflammatory chemicals in our bodies, helping protect our joints and decreasing pain that's associated with arthritis and other inflammatory conditions. On to number 3, and that is licorice tea. Licorice is a powerful ally in the herbal medicine world against inflammation because it contains a compound called glycyrrhizin, which inhibits an enzyme that breaks down cortisol. You need to be careful when you consume licorice tea, and you have to do it in moderation because excessive intake of licorice can lead to increased blood pressure. Number 2 is ginger tea. Ginger is a powerful anti-inflammatory drug. Ginger tea is comforting, it's warming, it not only fights inflammation, but it also boosts your immune system and is really soothing to the stomach. And number 1 is turmeric tea. That is at the top of my list, thanks to the active component in turmeric, which is curcumin, which is a remarkable anti-inflammatory compound. A quick tip there is to maximize the benefits of curcumin. If you combine turmeric tea with a pinch of black pepper added to it, the piperine in that black pepper will enhance the absorption of curcumin by up to 2,000%. Now, one other tea that's a bonus, and that is peppermint tea. If you consider adding peppermint to any of these other teas, it acts like a muscle relaxer. People know of peppermint for its topical effects. Well, that same thing can happen inside of our bodies as well because peppermint contains menthol, which has that cooling effect and helps to relax muscles inside and out of our gastrointestinal tract. Improving your health doesn't just stop at herbal tea. For over 20 years, I've been observing patterns in people with joint pain. How they look, how they feel, how they move, what their x-rays and their MRIs look like, which is sometimes pretty surprising, how their joint pain starts, how their joint pain heals, why it sometimes doesn't, and what can be done to get rid of it permanently. It's kind of crazy to hear myself say it, but I now have decades of knowledge from studying both the published research and the science in medical journals and studying in the real world with real people, many of whom are just like you. Maybe you've been given a diagnosis for your condition, so it has a name. Maybe you've been given a referral for an imaging study or to another specialist. Maybe you've been given a prescription medication or an injection or an infusion to treat your symptoms. Maybe you've been given a date for surgery or even had a full-blown joint replacement. But I am guessing that there's one thing that you have never been given, and that's a full understanding of what is actually causing your pain. I mean, the true, real underlying cause of your pain that needs to be addressed in order for you to get out of pain and back to living your best life. And by the end of this presentation, you will understand why you hurt, you'll take back control of the true underlying causes of your pain, and you'll learn exactly how to use that control to end your pain for good. Now, my experience with people who have seen other doctors like orthopedists and rheumatologists who have tried everything has earned me national recognition for helping even the most challenging cases to finally get lasting pain relief. And it's also earned me a reputation as a pain exterminator because of the solution that I developed to kill the joint-destroying termite enzyme that I will be telling you about here today. I have seen countless patients in pain, and helping them get out of it has put me in a really unique position. Now, the problem is that I've also seen far too many people have their lives stolen from them despite following the traditional conventional advice that they get from their doctors. These are folks that feel trapped in a prison of pain, living their lives from one doctor's appointment to the next, losing their independence as they become more and more dependent on medication, haggling with insurance companies about co-payments and refills. That becomes their full-time job, and generally feeling like the big, bright world is just growing smaller and darker around them. It's a painful thing to watch, and it got to the point where I couldn't stand to see this happen anymore without taking action. I was watching my own patients enjoying incredible natural pain relief, but with a waiting list at the office that was getting longer and longer every day. And that was just the people that lived within driving distance of my office here in Connecticut. And I knew that there were millions and millions more just like them in big cities and in small towns all across America. And that is why I made it my life's mission to reach people beyond the four walls of my exam room and teach people about the real root cause of their joint pain so they could benefit from my natural solution and get the same results that I've been seeing with my patients. And I'm grateful to report that it worked. And this turned out to be the best decision of my professional life. This solution has helped over 202,000 men and women with miserable joint pain, just like you, to finally be able to live their lives how they are supposed to be lived. Traditional inside-the-box pain solutions just weren't that effective for the people who came to see me. These are folks whose lives had been reduced to a constant cycle of doctor's appointments, trying new medications with new side effects, and then treating those side effects with more medications and never really getting better. In fact, I would frequently review years worth of chart notes from a specialist and see a pattern of more pain and a steady worsening of